Welcome to the 518th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome, and thanks for listening. Well, next week is the Cruel Jewel 50 Mile. I get another chance at redemption. 58 miles in Blairsville, Georgia, point to point to Blue Ridge, Georgia. Take two. So I'm very excited to get on the start line and get things going. Tweaked a few things. Been practicing with the pack. My toes are just about all healed up, so should be ready to go. My mileage is better than last year. My ankle is certainly much better than it was last year. Been doing a little bit of speed work and tolerating that good. I've added a little weight training with a vest. So I've taken my running vest and filled it with sandbags and walked up on a treadmill to 15% grade. I've also done some stair climbing. So if you want to do some pack training, I did my running vest with 7 pounds of sandbags in it and walked up and down my steps at the office for 20 minutes, which was a very good workout. So trying to get used to the pack, doing some core training, a little loosening. So ready to get going. It's been very hot and humid in Florida, which is a great opportunity to train for altitude-like conditions. But every year when the humidity comes in, it's a pretty rough week. I'm getting used to it. When you're running in hot and humid conditions, your heart rate tends to be higher than it was. Of course, you sweat more, you need to take in more fluid. So there's a bit of adjustment the first week or two of high humid running down here in Florida. But after that, it becomes okay. And, you do heat acclimate. People tell me that, when it's in the wintertime, they don't want to walk because it's too cold. And some of you that listen that are up in New York, that is a valid excuse when it's, 0 or worse or out west. But here in Florida, people say it's too cold when it's 40 degrees to walk. And then, of course, there's the thunderstorms in the afternoon and, the darkness in the morning. So people have all kinds of excuses for not walking, but heat is the biggest one right now. And you do heat acclimate. You just have to get out every day a little bit. So it's no reason not to. And actually, the heat and humidity is like a natural sauna. You can get rid of a lot of toxins, a lot of heavy metals through sweating. So it's really good to sweat and get rid of toxins in your body and make you, overall makes you much more healthy. I've also been practicing my mind game because that is a very large part of ultra running, but it's also a very large part of life. And I'm using the lessons that I learned from the past race, Skunk Ape, to focus on it a daily basis. Why am I going to run the race? What are my intentions? I'm there to finish the race. And when I do that in any daily activity, I'm looking at what are my goals. If it's doing something mundane as preparing dog food or doing yard work, it's used as a good opportunity. Yes, it's hot. Yes, I'm tired, but it's a good opportunity to train, and it's a good opportunity to practice your mental toughness. This past weekend, was doing a longer run, trying to get ready, and had some leg spasms, and I had my pack on and did some adjustments along the way, and actually everything got better. So, sometimes we get a little niggle or a pain, or things aren't going just right, or we just don't feel it right up front. We tend to throw in the towel early on, but take an opportunity to troubleshoot a little bit. What are the facts? Things don't always get worse. Sometimes things get better. A lot of times, starting my run out in the morning, that first quarter mile is pretty sluggish. Don't have much zip, but as you go, things start to loosen up and you start to feel better. So, give yourself the opportunity to loosen up and wake up and go before you throw in the towel. One of the things that happens in running an ultra, if you get a little niggle or a little pain here or there, you start thinking, Is this going to get better or this going to get worse? And quickly you jump to this could get worse. Am I injured? And all the negative things that may be going along with it. And it's not so much different from what I hear in the office. People start down a road of all the different things that may occur in the future. And as we get older, some of the things are kind of scary that can potentially occur in the future. And when we try to write, sometimes people try to actually write their exit plan. They know what's going to get them, whether it's going to be cancer or dementia or heart disease, and they start going down the road of all the bad things of that particular disease that's going to happen and when's the shoe going to fall. And I had a conversation with someone this past week, and I asked them, have you ever been able to predict anything in your life so far? Because most of what happens to us, it's presented to us and we react, but very few of us have ever written the story of our life and it been very accurate. Things happen, that we never expected, and sometimes they turn out really good. We look back and say, I'm glad that happened. It happened for a good reason, maybe better because of. But we still try to predict the future. And again, when it comes to negative things, it's easy to jump on and say, one bad thing after another is going to happen. And I think we lose sight of that and stop acting in the present and maybe troubleshooting what's going on now and what can we do to make our lives better now, so that the future might not be so scary. The general medical community, allopathic medicine, is quick to provide Band-Aids and crutches for us to overcome things that we learn not to participate. We're given blood pressure medications instead of really trying to change our diet. You can eat what you want, but take your blood pressure medicine, take your diuretic. So you go ahead and eat those salty things and those things that drive your blood pressure up, but the blood pressure medicine will, it's a false sense of security that that's going to save the day, when in reality, it does very little to prevent bad outcomes in the future. A little bit, but not a tremendous amount. The same way as with weight loss, often we're taught that it's nothing that we can control, and we're at the mercy of a medication to get the weight off, and it's a prolonged thing, and we'll never be able to do it. And we give up the fight very quickly and assume that we can't participate. The same thing is with mental health and depression. Oftentimes people are given medications that have actually never been shown to know the mechanism of action. There's never been any study to look at chemical changes in the brain and associate it with depression, but drugs have been made to alter the chemicals in the brain, so therefore we manufacture a reason to go with it. But a lot of times it takes the control away from the patient, and now they're dependent on the medication and fearful that it's the medication that's making their life better, not their own choices, when in fact they still have a lot of opportunity to make choices and to affect their quality of life. There's two types of patient that I see in my practice. It's those who want to be proactive and they want to be preventative, so they want to do lifestyle changes to prevent chronic diseases from occurring in the first place. And then there are those that are new to the game and have a chronic disease or a lifestyle disease, and they're trying to reverse it through lifestyle changes and nutrition. And I guess there's a third type of patient that somebody convinced them that nutrition changes would be good and that they should try it, but they're really not sure of the certainty, and it's not something that they necessarily want to do. And those people comprise very little of my patient population. That would have been the patient population of traditional medicine, where most people aren't looking for what they can do, but what can be done to fix the problem that they have so they can go on about their traditional lifestyle. For the most part, it's choosing your why. Why do you want to do a certain thing? And when it comes to change so great as nutrition and or exercise, it really has to be something that people want to do in order to have any lasting effect. And if you're already feeling bad from cancer or some other treatment, it's hard to fathom making a change in your nutrition that takes away what we call comfort or comfort foods in your life. People often say, it's the only thing I have left is what I eat and the food that I enjoy, or I'm a foodie, I live for food, I live to eat, not eat to live. But what does that really mean when it comes to these particular comfort foods? And again, they tend to be foods that we eat very quickly, that are high fat, high sugar. People eat them quickly, it's over. They're not satisfied, and you're just looking for the next food to eat. There was a study done recently looking at cancer patients and the result from traditional therapy with regard to their baseline skeletal mass and muscle mass. Those people that had an increased fat mass did worse with regard to an increased risk of cancer and also a poor outcome with cancer chemotherapy. People that had decreased skeletal and muscle mass also did worse with regards to overall survival and response to chemotherapy. And basically what that means is that metabolic health, they are very unhealthy to start with, and so it's very hard for their body to take on chemotherapy or a disease that is so metabolically disabling. It's hard for people that are used to eating sugary, fatty junk food to all of a sudden turn to vegetable juices and healthy food. You're much better off having a healthy diet to start with to decrease your risk of these diseases in the first place. But if someone wants to make the change, they can, but it requires them to really want to. When it's imposed on them, very little benefit. Fortunately, we're getting a new Surgeon General that I think has a pretty good handle on the state of affairs. 74% of Americans are overweight, 50% either have diabetes or are pre-diabetic, and metabolic syndrome or pre-diabetes carries with it all the same risk as full-blown diabetes when it comes to heart disease and vascular risk and increased risk of cancer. There's an increase in Alzheimer's over the past 15 years. There's an increase in early onset dementia, 3 times what it has been in the past 20 years. At this stage, it's reported that 1 in 2 Americans will get a cancer diagnosis. 77% of the population are unfit for military service, secondary to chronic diseases. Cardiovascular disease kills 800,000 people each year in the United States. 1 in 36 children will develop autism, 1 in 22 in California. Most of this is related to our diet and environment, leading to a decrease in overall metabolic health or our ability to use energy. Our body needs to produce energy in order for all of our functions to work. So not only muscle contraction and heartbeats, but breathing, hormone production, everything requires energy. Every part of our body uses energy and makes it. It requires that we absorb energy from our food, so we swallow it. It has to go into our bloodstream, and our body parts have to be able to take it up and use it effectively. The reality of it is that we're underpowered and that our bodies aren't getting enough energy because we can't take it up and utilize it. Some people aren't being provided the nutrients needed, but others have excessive amounts of nutrients, but their metabolic function because of lack of skeletal muscle, increased fat mass, they cannot use the nutrients to be able to provide energy for the body, and we get dysfunction. It's not because we're not testing enough, because we're testing more than we ever have. There's more blood tests, CT scans, MRIs, chest x-rays, various forms of imaging than there ever has been, genetic testing, blood testing for precancer, yet we're becoming more unhealthy. If I had a nickel for every person that came into my office saying that my doctor is following that with yearly tests, but they're still on medication, they still have lifestyle diseases, it doesn't make the disease go away. You just test and follow it. So how do you know if you're healthy? I actually got asked that in the office this week. What does health look like to you? Good metabolic health starts with a normal body mass index, which also means good muscle mass and good bone mass, not just a skinny person. Because we do see people that are very thin that have poor metabolic health because they don't have enough muscle mass. So what is your strength? Can you grip things? Can you hang from a bar? Can you do a push-up? Can you walk 3 miles in less than 20 minutes? Can you carry heavy things? A few months ago, we were at Lowe's picking up mulch, and we saw a couple that were probably in their late 70s and 80 picking up their own mulch and stacking it. Lowe's person came up and asked them if they needed help. And they said, no, we're getting it. And they loaded all their own mulch, and I'm sure they loaded it in their car, and I'm sure they unloaded it. Great exercise. So your ability to carry heavy things and not shy away from it. In my practice, I have an 89-year-old that does 5Ks and 10Ks on a regular basis. I have a 60-year-old that does 50 and 100 milers. I have an 86-year-old that does the steps in his retirement village, 4 to 10 flights a day. I have 80-year-olds that walk across swinging bridges, go whitewater rafting, and are not afraid to go ziplining. None of those people got that way in their 80s. They started training for these most of their life, actually. But it doesn't mean that you can't become fitter and stronger at any age. And that's been shown by numerous studies that weight training programs, even in nursing home populations, can be of benefit. Unfortunately, it only takes 2 or 3 days at bed rest to undo a lot of that strength training. So it is important to have as much strength as you possibly can. The standard American diet and people's usual environments of living inside and sitting around all day long is killing them. But the opposite of that is getting out and moving, and eating a plant-based diet has just the opposite effect. The healthiest people aren't the ones checking every biomarker known to man and worrying about the results of something that might happen down the road. It's not too much different than your car when the dealership of your fancy car wants you to come in for the 100-point tune-up at 50,000 miles. The reality of, has it ever caught anything that has saved you? It usually costs you money, but has it ever really made your car last longer or run better? On the other hand, just regular maintenance, putting in good gas, changing the oil, rotating the tires, cleaning your car, keeping the outside wax, does a tremendous amount to keep your car running for long periods of time. There was a study with metabolic syndrome and breast cancer, 42,135 breast cancer survivals. There was a 69% increased risk of recurrence and mortality in those with metabolic syndrome versus controls. This was 94.8 months of follow-up and 17 different studies. Metabolic syndrome shortens not only overall survival, but disease-free survival, meaning your disease comes back and you get to have treatment more. I had a class this week showing my patients how to use their smartwatches. Because I think there's a lot of information that can be gained, looking at sleep, looking at heart rate variability, VO2 max, but just checking off the boxes as far as how much you're exercising. Clicking that walk feature, clicking that run feature, knowing how far you walked, how long it took you, and how many days in a row did you do it. How many days can you look back and say that you got 10,000 steps? People often have they have the ability on their watches, but they never go and look back at the data. I think I walk about 2 or 3 miles a day, most days, but then when you actually go back and look, it's not really been that at all. So looking at that data and keeping track, I'm still a huge fan of the old-fashioned calendar to write it in because you can see it readily whether you did it or not. One of the newest features of smartwatches is that of blood pressure measurements. And it's good to have a normal blood pressure less than 130/80 in most individuals. As we get older, we may need a little bit more blood pressure to perfuse our brains. But for the most part, we want a blood pressure less than 130/80. And can these blood pressure sensors on your phone or your watch tell that? They look at a different method than the sphygmomanometer that you get at the doctor's office. And unfortunately, most doctor's offices don't do manual cuffs. They do automated cuffs, which aren't very accurate. Their office much as 10 to 30 points in individuals. Cuff size matters. Where you put the cuff matters. If your legs are crossed matters. How you're breathing matters. But these sensors on the phones and the watches look at a change in optics and a pulse transit time. And although they've been FDA approved to market, they've never been really tested or validated. And for the most part, they're not that accurate. They're certainly less accurate in people that have valvular heart disease or atrial fibrillation or diabetes or obesity or vascular disease. So the very people that it would be nice to be able to measure these things, the technology is not quite there. But heart rate, you can look at very easily, and that's usually pretty good. There is some fallibility with that as well. But you have to look at it and see what your own trends are. There's more and more evidence that's coming out, despite people's wishes in the general population, that a plant-based diet actually decreases lifestyle diseases, and growing evidence that a plant-based diet will actually reduce cancer risk or decrease cancer recurrence. There was a study in Nature Microbiology that actually looked at the microbes associated with how people eat. They compared vegans, vegetarians, omnivores in over 21,000 people. And omnivores had more bacteria associated with increasing risk for colon cancer. The people that ate a plant-based diet had the best microbes for cardiometabolic health. So again, plant-based diet, you select for microbes that are more beneficial, less anti-inflammatory, better immune system. Unfortunately, the reviewer at Johns Hopkins says, well, plant-based diets, they vary all over the place, so it's hard to really say what a plant-based diet is, so let's dumb it down. She didn't say dumb it down, but let's dumb it down and say that you should eat 2/3 vegetables, fruits, whole grains, beans, and 1/3 animal protein would be okay. That's no different than the standard American diet. When I was growing up, we had a piece of meat, a potato, and a vegetable. Basically 2/3 plant-based. But for breakfast, it might have been eggs and bacon grease. The meat itself was often pork or fried something. The vegetable might have been fried. So 2/3 plant-based is, I guess, good for some people. It's better than nothing, but it's not really moving the needle very much, especially when it comes to reducing cancer risk. Your returns are pretty equivalent to your efforts. And the more you phone it in, and I eat a little bit of meat here and there, a little chicken here and there, the less results you're going to get, because those products change your microbiome for the worse. They make your system more acidic, and they decrease the good microbes. They make your immune system less. They make your inflammatory overall health much worse. Can I eat what I want and take beetroot powder or a nitric oxide supplement? Even if you eat 6 cups of greens, but you have a steak along with it, it will actually block the enzymes that produce nitric oxide. So the powders and pills don't stand a chance. They're digested or neutralized in your acidic stomach. So even eating meat, you decrease the availability of the greens that you eat to produce nitric oxide and improve your endothelial function. Should I get a CT angio to look at soft plaque? Because it can be measured now, and we can look at the flow in the coronary arteries and see whether or not we have significant blockages. What are you going to do with the results? It's a picture, it's not function, because those tests don't show collateral circulation. Good old-fashioned nuclear stress test, if you're worried about blood flow to the heart and you're having symptoms, would show whether or not the heart is being perfused with blood. And that's how that works, before and after pictures with nuclear imaging. But it's not even necessary in the asymptomatic population. No tests are without false positives. No tests are 100% specific or 100% sensitive. So you have to figure out what you're going to do with the answer, whether the answer is right or wrong. The other problem is that all the CT scans that we're doing now have been associated with an increased risk of cancer. Up to 5 to 10% of all cancers may be related to imaging studies. So do your routine chest x-ray, your scan of your back, your scan of your arteries, your DEXA scan, put those all together every year and you're getting a significant amount of radiation. Did I mention the healthy people aren't getting scanned, but they're out doing things? Sometimes people think drugs, and especially topicals, are okay and benign, things you put on your skin. We know that chemicals are absorbed through the skin because we give people nitro and other blood pressure medicines through the skin that can be absorbed into the system. All they need is to be packaged with a little bit of fat, and they're sucked right into the skin. There was a recent study looking at finasteride, which is Proscar, which is a drug originally released in 2017, I believe, to decrease benign prostatic hypertrophy symptoms, help people pee better, help men pee better that have thickened prostates. It's a 5-alpha reductase inhibitors. It interferes with the conversion of testosterone to 5-alpha dihydrotestosterone. You don't have to be a chemist to realize when you're interfering with the conversion of testosterone into an active metabolite, there can be a problem. So while it may grow hair in a little bit, the risk has started to become severe enough to be labeled as suicidal risk, increased risk of depression. It appears that the chemical is absorbed through the skin and actually crosses the blood-brain barrier. The worst part of all that is even after treatment has been discontinued, it appears to hang around for a while. And the metabolites can be in the cerebrospinal fluid for some time. So there is a warning label for an increased risk of psychiatric and suicidal events that can persist long after treatment is discontinued. And it's described as post-finasteride syndrome. When people go to the dial-up online pharmacies where there is a physician waiting to sign a prescription form with little or no history and a side effect occurs, there's no resource. So if you're going to take a prescription medication, please consult with a doctor that you can also consult with should there be a problem. And that's not the half of it, because we don't know how these medicines also interact with other medications. 13.2% of United States adults report use of antidepressants, 19% in people over 60. So again, an even higher population that might also be prescribed finasteride. So always ask your doctor, if you're on more than one medication, how do these interact? How are they metabolized? If they're both metabolized through the liver or they're both metabolized through the kidneys, you could get into big troubles. Topical medications are not benign. They're absorbed into the body, just like the non-steroidal anti-inflammatory creams that people swear by. They're also absorbed through the skin and can cause the same side effects as regular non-steroidals as far as kidney damage, increased risk of heart attacks, cardiomyopathies. So are there plant-based foods for hair growth? Some people think that they have worsening hair going plant-based. I will tell you from a personal anecdotal experience, my hair has never been better since I've been plant-based. As I grew up, I had pretty thin hair, but my hair is much healthier than it ever has been being plant-based. People worry about being biotin deficient, which is B vitamins, but again, B vitamins are readily available in plant-based nutrition. Best foods for hair growth: lentils across the board, legumes, seeds, avocados keep coming back as far as being a very nutrient-dense fruit that has a lot of vitamins. Chia seeds, sweet potatoes, again, tremendous amount of benefits. Besides hair growth, spinach, berries, nuts, hemp seeds, hemp hearts. And the hemps and the chia seeds also have omega-3 fatty acids. People have looked at zinc, iron, iodine, and B vitamins as a cause for hair loss. Certainly hypothyroidism and polycystic ovary disease is a risk for hair loss. Stress is a risk for hair loss. Postpartum is a reduced for hair loss. Bariatric surgery is a risk for hair loss, mainly because of lack of nutrient absorption from the bypass. Again, treatment with lysine, which is an amino acid, zinc, and iron, all can be done through nutrition. They don't have to be done through supplements, legumes, spinach, all kinds of greens, broccoli, kale, plenty of zinc and iron. If you really want to go for it, you can throw in some fortified cereal. You can throw in some pumpkin seeds onto your cereal. Certainly fortified grains. Soybeans are a huge source of biotin B2, which is good for your nails, and to make strong nails and strong hair. Whole grains as well. Mushrooms is another good source of biotin as well as vitamin D. The best part is there's no added ingredients in these whole foods that cause a problem. There's no excessive amounts of saturated fats, cholesterol, or other chemicals. You know what you're getting when you eat a sweet potato or when you eat beans. People are always worried about their protein. Lysine is an amino acid that's associated with muscle growth as well as hair growth and skin. Readily plant-based sources of lysine: avocados, mangoes, apricots, beets, leeks, tomatoes, pears, green and red peppers, potatoes, legumes, especially soy, tofu, tempeh, edamame, soy milk. All kinds of beans, but highest in kidney beans, black beans, and navy beans, pumpkin seeds, cashews, quinoa, aramuth, buckwheat, seitan, and spirulina. If that doesn't do it, nothing will. Because in a plant-based diet, you don't get just one source of nutrients. We drip in our nutrients from a variety of different sources, and that's why it makes it very difficult to add up at the end of the day. But if you're eating a plate that's colorful and a big variety of different foods, you're sure to get all that you need. People that just eat white bread and rice and cereal, yep, you're going to be at a problem. And actually, a lot of fortified cereals they're vitamins that are added that aren't readily absorbed. So you're better off getting this from the whole foods. It comes back to, what are you looking for? What's your goal? Is it to run an ultra marathon? Is it to go ziplining when you're 80? Is it to be healthy and live independently well into your 90s? Well, you can do all that and eat what you want, and I'll say good luck. But otherwise, it takes some planning. It takes movement and nutrition and a focus on it. So it's better to learn now things that you like that are plant-based. Find recipes that you enjoy, that your family enjoys, and make them your go-to recipes. Have certain things, once a week. We like burrito night. We like our gnocchi and cabbage and sauerkraut night. We like a stir-fry night. We do a pasta night with multiple vegetables and pasta primavera. We eat tofu a variety of ways. We put mushrooms in most of our dishes. We have greens twice a day and up to about 6 cups or greater from a variety of sources, whether it's a big kale salad at lunch or broccoli and cauliflower at dinner and in another side salad. But we look to get lots of greens into our diet. It doesn't have to be expensive. White potatoes are very cheap. Sweet potatoes are very cheap. A bag of greens, some peppers, onions, a bag of beans that you can cook on your own. You can make this very cheap. It's when you start buying boxed and processed foods that aren't near as good for you as you start making it expensive and probably aren't covering the nutrients that you would have. Embrace learning about the benefits of plant-based nutrition and like it and have a positive attitude, and you too can avoid lifestyle diseases or keep your lifestyle diseases from recurring. Remember, if you're not treating the root cause, a recurrence of your disease is inevitable. If you'd like to learn more about our practice and how we help people, please contact us at Jami, or contact me at jami@drdulaney.com. You can look at our website, drdulaney.com. We have a whole host of recipes, wellness programs, exercise programs, and you can join for as little as $25 a month to get all of our online content, or you can upgrade to have consults with our registered dietitian and myself once a month, or become a full member. The choice is yours. I wish you good health. Don't wait till you're sick to try to turn back the clock. Do it now so that you too can live a happy and healthy, fun-packed, adventurous life. Thanks for listening. See you next week with a race report on how I finished Cruel Jewel 50 Mile. Thanks.